video. Again, this is the third little video within the overall video on antipsychotics. We've been talking about first generation or typical antipsychotics, the type of antipsychotics that were made first in the 60s and 70s. I've talked about their side effects, but I haven't mentioned any names to you. They have, generally they end in a ol, so you have haloperidol, which is one of the few ones we still use. We have zuclopenthixol, anything that sounds like that, long, lots of X's and Z's with penthixol at the end, tends to be a first generation antipsychotic. Let's talk about the newer medications, the second generation antipsychotics, the atypicals. Now, as I said, these were made to try and combat the horrible side effects you get, mainly the EPSEs from the first generation, the typicals. And they generally did quite well. You're much less likely to have EPSEs with a second generation antipsychotic. But what you do get generally are metabolic symptoms. You get the metabolic syndrome. People put on weight enormously. They get really hungry, very lethargic. We also, so to help sort of get a flavour of how each of them work, there's only about 5 or 6 that we use commonly, and they're used much more frequently than the first generation antipsychotics because of the side effect profile. But to understand each of them and their sort of personalities, it's helpful to know how they came about. So let's start with risperidone. That's one of these second generation antipsychotics. It's pretty good. It makes you pretty hungry, makes you pretty sleepy, as lots of these do. It makes you put on weight quite often, but it's quite good at treating the psychosis. Now, we also have a similar medication in that class called olanzapine. Now that makes you really hungry and really sleepy, but works very well. So if somebody's very acutely unwell, it's quite a good thing to treat them with, but you have to be really mindful of the metabolic syndrome. I've had patients where from when they've come in, they've been very unwell, very paranoid, unable to continue their life, very, very worried. I've had patients who've moved hundreds of miles away from their children and families because they've been so scared in their psychotic state, and they've responded so well to olanzapine. But as you can see, that psychosis melts away and then regaining insight and feel safer. You can see them balloon up as they put on weight. They're so hungry, they're so sleepy, because it's sedating and it really stimulates the appetite. So to combat that, a medication was designed to do the opposite of that, to try and give all of the benefits, but not be sedating so much and not make you so hungry and cause the metabolic syndrome. That medication is called clozapine. Now, clozapine works really, really well and does not have those side effects as much, but it has a whole different set of side effects, and we'll come on to that in a moment, because clozapine should be considered a slightly different class of its own, although it is technically an atypical or a second generation antipsychotic. Another medication in this class is quetiapine. I don't know if we mentioned that. That's a commonly used one. And the one we haven't mentioned is aripiprazole. Aripiprazole is slightly different. I think it's slightly newer. Instead of making you sedated, it actually wakes you up a little bit. So we give that one in the morning. The others we give in the evening to try and help sleep and not have somebody sedated all day. And it also doesn't cause the real hunger that can cause people to put on an awful lot of weight. So aripiprazole is a really good one. Anecdotally, it doesn't work quite so well on the psychosis. So do we tend to start with that, see if it works. If it doesn't work for the psychosis enough, then we switch quite quickly to one of the other ones. So that would be quetiapine, risperidone, or olanzapine, and treat them with that, because it's much more harmful to be psychotic for longer. It means you're more likely to be psychotic again in the future and more likely to take longer to recover. So it's really important that we treat properly and just be really mindful of these side effects.